but as far as I know, it hasn't. We haven't failed to put ink on that deal yet. So once we get that, we'll probably spin out this email list. And then anyone who wants to read into what the methodology is for the calculator and how it works, and read more about Dr. Friedman's analysis, can click on this link down here at the bottom of the page and read these 3 bullet points of how the calculation is actually done. Like I said again, it's all based off of income. If that individual makes less than $53,000 a year, there's a 3% earned income tax. If it's they make over $53,000 per year, that's a 6% payroll tax. Any individual who has unearned income, so interest, investment, rent income, etc., that's all taxed at 6%. And then anyone who makes over $225,000 per year in total income. No, actually, it's $225,000 per year, I believe, in earned income, not total income, it's earned income. That's taxed at an additional 6% surtax. So it's not an additional 6% tax on their income. It's a 6% on top of the. It's a 6% tax on the 6% additional earned income. Hopefully that wasn't too confusing. It took me a while to figure out exactly what was meant by surtax. So that is the quick overview of the Medicare for All calculator. One of the details that one of the things that I've added to it that is quite interesting is that since we have to run the calculation, all that data gets sent back to my server to do the calculation and return the results. Since we're getting all that data, since we're getting all that data, one thing I can do is remove any identifying information about any individual, but I can get their, like where their location is roughly, like what city and state do they live in, and their, and the income and the expenses that they've reported on the form. From that, we can look at what areas of the country are going to be impacted in certain ways based off of a Medicare for All plan, or certain areas going to be more benefited than others based off of, maybe some areas have a really high income and others don't, for example. So I do have, I've been collecting some data as the website's being used. And hopefully as time goes on and it gets more use and more adoption, we can actually have some analysis that we can release out to people and educate people about it. This is what Medicare for All really means to people all across the country using the numbers that they've actually put in themselves. So it becomes less of a theoretical, yes, everybody needs healthcare and healthcare is a human right, and all that regular, those talking points, and move from that to an actual, this is what it's going to mean in dollars and cents. And I think that if we can move people in that direction, then I think we have a lot of hope of making Medicare for All a reality and actually making it happen, because then it can go from being purely a social justice issue, which I think is an important issue, but go from purely social justice to going into both social justice and an economics argument. So I think with that, I think I've covered most of everything I think I want to cover with it, and I'll happily turn it over and ask. Let's see what questions everyone has.
I have a question. I actually have a double-sided question to ask you.
Okay, let's hear it.
But first, I want to be sure that people understand that this is not a government-run system that you're talking about. I forget some words you used. I didn't write them down. And I thought it might be confusing to some people who are unfamiliar with the fact that the government will collect the money, but pay it to private providers. And that's the way it'll be. But I was wondering how many people have used the calculator so far.
That is a really good question. And I was just running the numbers today in preparation for this. Let me bring this, this analysis up. Let's see if I can share that. Okay, does everyone see a document that says analysis August 9th, 2018 on it?
Yes,
Yes.
I do.
Okay, so this is an analysis I did about 2 hours ago based off of what we've seen so far with the calculator. The important thing, we've had 78, what looks like 78 unique people have used the calculator, and the average savings so far based off of their numbers is averaging about $2,000 per year. Of those 78 people, we have the majority of them are from New Mexico. We have some people that we don't know where they're located. But interestingly, we've had a number of people from Oregon, some people from California and Texas, and a bunch of a bunch of states, mainly seems Western states, and then a couple sort of interesting places like Holland, and I guess that's probably Austria. But anyway, so some people are running into it, and based off of, shrink this down a little bit. Oh, wrong direction. So based off of the people who've seen it so far, this is a histogram of the on the vertical axis are the number of people who have used the site, and on the horizontal axis, I've binned those people into how much they would save per year. And what we see, the big spike, and granted these are small numbers, so we can't put a whole lot of faith in them, but we see is this big spike right around that probably $2,000 to $3,000 per year. This is where the majority of people are. That the majority of people are going to save somewhere around $2,000, $3,000 per year. So these are the numbers that they've entered into the site themselves.
Thank you very much. And you actually answered the second part of my question.
Oh, excellent. I got a little excited there.
Okay. Are there any other questions from listeners?
We
Yes,
have
I have.
is that MJ? We have a question from MJ Ebert.
Yes, hi.
Hi.
Can you hear me?
We can.
My question is this: a good number of people, employers, pay their healthcare premiums today, or at least a portion. Would you expect that employers might then cover the 3% or the 6% premium under this plan?
That's a good question. I guess it would be possible. The hope is that, I guess my standpoint, I'm not sure if there's an economist that's looked at this, but my expectation would be that if the employer's not paying a health insurance premium, hopefully that money is going to go into that, employee as salary. And then the taxes would be levied on that salary.
That is not going to happen.
It's, it is possible. It's possible it's not going to happen. It's possible
I think
that it would happen. I'm not sure.
I actually think that you'd be better off encouraging those employers to continue to cover this cost as a competitive advantage for that company.
Well, I think that's it. It becomes a negotiation point, and I think businesses would like to get out of the health insurance business if they want to continue paying a fee to an employee as in lieu of taxes. That's up to them.
Yeah, I agree. It would be really interesting to see how that plays out, right?
There are other plans, and I worked on the Massachusetts bills. Actually, I chaired the committee that wrote the last 4 Massachusetts bills. And those bills did have a certain amount paid by employers who earned a certain amount a year, and a certain amount paid by employees. That's how the Massachusetts bill was written. And I believe I've left Massachusetts a year ago, but I believe the present bill is still that way.
Okay, thank you, Judy.
I have a question.
Go ahead.
And
Go on.
hello,
Yes.
my question is, Kris, did I hear you say that you did not figure in the 1% or less than 1% tax on stock and bond transactions, that you just with the percentages on the income?
That with the calculator, yes, I don't have any calculation there on the 0.5% stock. Let me look at that again. I'm sorry. There's a little tapping on the line. I'm having a hard time concentrating, so I'm having a hard time hearing. Thank you. There is a let me bring up Dr. Friedman's analysis real quick. Okay. Yeah. Let me share this really here. Okay. So we're talking about this this 0.5% tax on stock trades and 0.01% tax
Right.
on bonds and swaps. That is not in the calculator. It seemed to me that I couldn't figure out a way to make the calculator both easy to use, and I was afraid of adding that in would add some complexity, would scare people away from it.
Yeah.
So
And it also is not a standard tax now. But if that were to become true and that funding went towards this program, it would mean even more savings for people, wouldn't it?
Yes, well, it would. How to put this? From the calculator standpoint, the majority of people, it wouldn't mean more savings.
Okay.
I think all it would do is those people that are involved in stock transactions or bonds or swaps, it would increase their tax liability. So the calculation will only go to making the tax higher, but I don't think it wouldn't affect the vast majority of people.
Yeah, that's a relatively small part of the population who are generally already the more wealthy.
Mm-hmm.
Great. Okay, any more questions?
Just a comment. Be wary of the statistics on how many people from where check use your calculator, because I would be tempted to sit and run half a dozen of them, and that will screw you up. So
Yeah, and I've thought about that, and so I do know that there with the analysis there are a lot of assumptions I have to make, and there are a lot of compromises I have to make. So with that analysis that I did, what I did do was I made the assumption that with every IP address, now granted that's not a great metric, but I have to do something. So
sure.
with every IP address, I'm assuming that the numbers that the individual entered first are the most likely to be accurate.
Okay, that works. Yep.
And so then I ignored all the other entries after that.
Cool.
But as we get more data, I mean, I can definitely go in there and start playing with those numbers and see what seems to make sense and what doesn't, and try to understand how people are interacting to see what could be the most realistic. But we can only do so much. So.
Yeah.
Kris, I have a couple more questions.
Please.
The first one might fall in the "we can only do so much" category. We'll see. I wondered, what we've seen happen is that as more people have health insurance, through the Affordable Care Act and so on, people then tend to go and get the care that they need, which is good. That also means, and of course, cost associated with that care. Did you have to try to figure out a way to factor in potential additional services that would be sought under plans like this?
Well,
That was outside of the scope of what I'm trying to do here. I'd have to look. I guess what I'd probably do for doing that, and I don't think that's something I can do in the calculator, but it's an interesting question. Probably a good place to look first, I would think, was the results of Massachusetts plan, and see what the increase in costs were for them. Maybe Judy, maybe you can speak to that. I'm not sure.
well, I want to say that the Massachusetts plan has not been passed, and it certainly hasn't been implemented. I will tell you that the former director of Mass Care, who created the Massachusetts legislature, is now running for the state legislature. And I'm hoping that he'll win, because I think he'll be a powerful force in the legislature to get single payer not only passed, but implemented. And we'll see. But what I've just taken out of my file something that tells all the things that HR 676 provides. And it provides a number of things like dental care and hearing aids. I still don't see my list, but a number of things that are not provided under the Affordable Care Act. And one of the things that is always very important to me is the fact that when ACA was passed, the legislators were forced by the lobbyists to see that pharmaceuticals were not negotiated for, so that the big pharma keeps raising its prices every time you breathe. But, or that's an exaggeration, but I don't think very much. But HR 676 will have negotiated prices and wholesale, and will buy wholesale pharmaceuticals and medical equipment. That will be a big, big saving. And Dunlap, here I was going to say Ann Dunlap has been on this webinar. I don't see her right now,
Yes.
but I did find my list of benefits. And long-term care is also included under HR 676, and dental care and hearing aids.
The other thing on cost,
Vision care also.
sorry.
Yeah.
Yeah, the other thing on cost issues is that we have a tendency now to have private insurance postpone treatment every way they can until somebody hits 65 and they can be dumped into the public system. If you're on one system your entire life, they have an incentive to cure you early so that they don't rack up all those bills.
Yeah, and the insurance companies, even under Medicare, do deny care for their own reasons.
Well, traditional Medicare has been pretty good about not denying a lot, which is the Medicare Advantage plans and the things that are like hidden preferred provider organizations or HMOs calling themselves, Medicare Advantage, do whatever. It's a different story. Yeah.
Okay, any more questions or comments?
MJ had another question about, is this really, you know, how is this not a government program? Or, you know,
Well,
I'm trying to unmute her. There we go.
because the government, well, the hospitals will be private hospitals, the physicians and the other providers will be private. They won't be working for the government, as the VA does now. The VA is a government plan, but HR 676 will not be.
The phrase we used to use during the PPACA things was publicly paid, privately delivered. So that, you know,
Right,
right.
right.
And I think that the comparison with Medicare really helps people to get the gist of it. So that'll help.
Yeah, and I really misspoke when I said Medicare. The insurance companies deny care. That is under Medicare Advantage only, which is special.
Yeah. Emily has a question?
Yes, can you hear me?
Yes.
I can hear you, Emily, yes.
Yes, I think another point is that all the providers are nonprofit. There will be no insurance companies allowed. Insurance companies will only be used for anything that is not covered under the Medicare for All benefits, and these are mainly cosmetic services. So there are many, many services that are covered that are different from Medicare and even insurance. And I wanted to add that Medicare does have several restrictions as far as hospital days, number of pints of blood you can get, ambulance services. These will all be covered under Medicare for All.
Right. The current Medicare, a lot of people have supplemental plans to cover.
Right, and they're
They
expensive.
pay a lot for those.
Yeah.
But this is a good way, I think, to bring quality health care to all residents in this country at a price that people and the nation can afford.
Yeah.
Don't forget, we spend more than most any other country, and the quality of our health care is not high. The World Health Organization rates us 37 in the quality of health care among industrial nations. It's really a shame.
Right. What we are paying, if I remember correctly, what we are paying publicly and our tax dollars would pay for the equivalent is about what other countries are paying, and we are getting 37th quality out of it. That doesn't even count what we're paying through the private system. So it's nuts.
Well, my understanding is we're paying much more
Right, exactly.
than other countries.
Yeah, because if you take all our private money plus our public healthcare money, it's off the charts.
Right.
Right.
Who is speaking?
That's Sally.
Okay, I couldn't tell. Anybody else with a comment, a thought, a question? Well, I would like to thank Kris tremendously, not only for the presentation today, which I appreciate very, very much, but also for making the calculator. I have no idea how such a thing can be done. I could hardly get on Zoom, but thanks to a lot of helpers, I've learned. And maybe I'll get on Zoom some more. Shall we leave now, or does anybody want to say something?
Yeah,
Okay.
I just wanted to say thanks, Kris. This is the incoming administrator of UUJEC, Christopher Sims, and I find the calculator fascinating and interesting and refreshing just the same. And I love the conversation that has come out of your sharing and Judith's knowledge. So I think we've had a great conversation and looking forward to more with the development of the calculator.
Thank you, Kris. I really appreciate
Thanks,
that.
Kris. And by the way, the Kris who just spoke a moment ago is CHRIS, whereas the Kris whose picture you just saw, Kris Hardy, is KRIS.
Yes.
They just like to confuse us.
Mhm.
Mhm.
Yeah, this is really interesting. Thank you so much, Kris, KRIS, and Judy.
Thank you. Thank you so much.
It's been a learning experience for me.
All right. Next month, our topic is too many bankers. We're going to talk about financialization of our economy and generally how Wall Street is kind of a little bit out of control.
A little bit? I would say that's an exaggeration or an underestimation.
Yes.
Okay,
That will be September 9th. Yep, second Thursday.
same time.
Thanks, Sally.
All right. Thank you all.
See you all.